Hi, it's Jane, and on today's episode of Healthier You, I thought we would talk about insulin resistant diet as well as a suggestion for some eating tips, a dietary thing for someone who has insulin resistance. All right, but first of all, let's start with the medical disclaimer. Always check with your physician before starting any exercise program or eating program. Information here is my personal research into different health topics and is not to be considered medical advice. All right, let's get into it. Insulin resistance and prediabetes. Insulin resistance and prediabetes occur when your body is not using your insulin well. Insulin is the hormone that is made by the pancreas that helps glucose in your blood enter the cells in your muscle, fat, and liver, where it is used for energy. Glucose comes from the food you eat. The liver also makes glucose in times of needs, such as when you are fasting. Sometimes you're fasting for other reasons, like mine was. I was sick this week, so I was really fasting. But anyway, that's kind of what happens is your liver will take over with your blood sugars. When blood glucose, also called blood sugar levels, rise after you eat, your pancreas releases insulin into the blood. Insulin then lowers blood glucose to keep it in a normal range. Hold on. I'll be back in just a second. Okay, what is insulin resistance? Insulin resistance is when the cells in your muscle, fat, and liver don't respond to insulin and can't easily take up glucose from your blood. As a result, your pancreas make more insulin to help glucose enter your cells. As long as your pancreas can make enough insulin to overcome your cell's weak response to insulin, your blood glucose will stay within a healthy range. Prediabetes generally means your blood glucose levels are higher than normal, but not high enough to be diagnosed as diabetes. Prediabetes usually occurs in people who already have some insulin resistance or whose beta cells in the pancreas aren't making enough insulin to keep blood glucose in normal range. Without enough insulin, extra glucose stays in your bloodstream rather than entering your cells. Over time, you could develop type 2 diabetes. How common is it? More than 84 million people between the ages of 18 and older have prediabetes. That's about 1 out of 3 adults. Who is more likely? People who have a genetic or lifestyle risk factor are more likely to develop it. Some of those risk factors are overweight or obesity, age 45 or older, a parent, brother, or sister with diabetes. And this is one that gets us all because we don't have any way around it. African American, Alaska Native, American Indian, Asian American, Hispanic, Latino, Native Hawaiian, or Pacific Islander American ethnicity. You can't run from your ethnicity. Physical inactivity, health conditions such as high blood pressure and abnormal cholesterol levels, a history of gestational diabetes, history of heart disease or a stroke, polycystic ovary syndrome, which is also called PCOS, PCOS. People who have metabolic syndrome, a combination of high blood pressure, abnormal cholesterol levels, large waist size, are more likely to have prediabetes. Along with those risk factors, other things may contribute to insulin resistance include certain medications such as glucocorticoids, some antipsychotics, and some medicines for HIV, hormonal disorders such as Cushing's syndrome or acromegaly, sleep problems such as sleep apnea. Although you can't change risk factors such as family history, age, or ethnicity, you can change your lifestyle risk factors around eating, physical activity, and weight. These lifestyle changes can lower your chances of developing insulin resistance or diabetes. Being overweight, having obesity are risk factors for developing insulin resistance or prediabetes. Now, I'm going to say this about prediabetes. I had a doctor who believed there is no such thing as prediabetes. That's like being pregnant or not pregnant. You either are or you aren't. So if they saw a spike in your blood sugar and it was one that stayed that way over several weeks, they consider you a diabetic. Researchers right now still do not fully understand what causes insulin resistance, but they do think it is a factor of excess weight and lack of physical activity are the major factors. Could be. When I was much more active and running about an hour a day, probably four times a week to 5 times a week. I was pretty active. Raising kids, running around with the kids, all kinds of things. Still had diabetes. So, who knows? Couldn't get the weight off either. And that tends to be something that is true with people who are insulin resistant. They have a little harder time losing weight. Experts believe that obesity, especially that with too much fat around the abdomen or the organs called visceral fat, is the main cause of insulin resistance. A waist measurement of 40 inches or more for men or 35 or more for women is linked to insulin resistance. This is true even if your body mass falls within the normal range. However, research has shown that Asian Americans may have an increased risk for insulin resistance even without a high BMI. So there's that. Researchers used to think the fat tissue was only for energy storage. However, studies have shown that belly fat makes hormones and other substances that can contribute to chronic or long-lasting inflammation of the body. Inflammation may play a role in insulin resistance, type 2 diabetes, and cardiovascular diseases. Excess weight may lead to insulin resistance, which in turn may play a part in the development of fatty liver disease. Physical inactivity. Not getting enough physical activity is linked to insulin resistance and prediabetes. Regular physical activity causes changes in your body that make it better able to keep your blood glucose levels in balance. What are the symptoms of insulin resistance? Usually, there are no symptoms. However, some people may have darkened skin in the armpit or on the back, sides of the neck, a condition called acanthosis nigricans. Many small skin growths called skin tags often appear in those areas as well. Even though blood glucose levels are not high enough to cause symptoms for most people, few research studies have shown some people with prediabetes already have early changes in their eyes that can lead to retinopathy. This problem is more often with people who have diabetes. And sometimes there may be an eye doctor when they do the test where they dilate your eyes, may ask you if you have diabetes because they are seeing signs of it within your eyes, which is basically small little bleeds in the back of your eye. Doctors do blood tests to find out if you have prediabetes. They don't usually test for insulin resistance. The most accurate test for insulin resistance is complicated and used mostly for research. For someone who has prediabetes, doctors will find a fasting plasma glucose or an A1C test to diagnose that. Less often, doctors use oral glucose tolerance tests, which is more expensive and not easy to give. It's awful. If you've been pregnant with gestational diabetes, you know how bad that test is, because they generally do it when you're pregnant. An A1C actually tests your blood levels for the past 3 months. However, the fasting plasma glucose and the oral glucose tolerance only show what your blood glucose levels are at the time of the test. The A1C is not as sensitive as the other tests, and so often you're going to miss it, miss that pre-diabetes diagnosis that you would get with the oral glucose test. People with pre-diabetes have a 50% chance of developing diabetes over the next 5 to 10 years. You can take steps to manage your pre-diabetes and prevent type 2. The following test results show pre-diabetes. A1C 5.7 to 6.4. You ideally want it under 5.7. The fasting glucose test is 100 to 125 milligrams per deciliter. The oral glucose tolerance test is 140 to 199 milligrams per deciliters. You should be tested for pre-diabetes if you are overweight or have obesity and either one of more of the factors, Even if you don't have risk factors, you should start getting tested at age 45. If the results are normal, but you have other risk factors for diabetes, you should be retested at least every 3 years. How can you prevent or reverse insulin resistance or prediabetes? Physical activity and losing weight. Smaller steps such as eating healthier foods, smaller amounts helps helps you to move more weight loss. Those things can help reverse that or prevent type 2 diabetes. Physical activity can help. So some of the things that they tell you, and there are medications that they can give you oral medications. Metformin is something that they give mostly to women who have a history of gestational diabetes, younger adults, or people with obesity. Some of the things you can do in the meantime is to make a plan, track your progress, get support from your healthcare professionals, family, and friends. Make those lifestyle changes to prevent or reverse that. You may be able to also take part in a lifestyle change program as part of the National Diabetes Prevention Program. Now, there are many of us who believe that I am one of them, that the National Institute for Diabetes, the Diabetic Association, their diet is way too high in carbs for a diabetic. So you could follow that plan but lower your carbs. So that's one way. Now, there is a group that put together a nice little plan for doing a no sugar. It's a 7-day no sugar meal plan for insulin resistance that was created by a dietitian. Now, you can find this plan if you go to Eating Well and do a search for 7-day no sugar meal plan for insulin resistance. That article should come up and you should be able to find it quite easily, those kind of things. One of the things that the diet really focuses on is to keep your calorie level, 1,500 calories per day. Also, there are modifications for those for 1,200 calories a day or 2,000, depending on your calorie needs, hunger levels, and your blood sugar level readings. That you will need to determine with your doctor and/or a dietitian. Insulin resistance friendly foods focus on vegetables that are higher in fiber, such as Brussels sprouts, beets, collards, and artichokes. Starchy vegetables such as winter squash, corn, sweet potatoes, and potatoes. Lean proteins such as fish, chicken, turkey, beef, pork. Fatty fish rich in omega-3 such as salmon, mackerel, and tuna. Fruits with skin, high in fiber, more likely like berries, apples, and pears. Whole grains like oatmeal, quinoa, fonio, and farro. I think farro, F-A-R-R-O, for many of us is reminiscent of cream of wheat. That is something that's called farina, and I believe that is created out of breaking down that. Then there are lentils and beans, nuts and seeds, plant-based oils like olive and avocado, probiotic-rich dairy products such as Greek-style yogurts. And here are some tips for prepping your meal for a week of meals. Meal prepping at the beginning of the plan makes it easier for you to follow it throughout the week. Make vegetable weight loss soup for lunch on days 1 through 3, and they do give you a diet for that. Prepare some homemade trail mix for snacks. Whip up dill pickle dip for snacks. Don't think I would appreciate that, but some of you may love it. And then they go on to present the diet with a meal plan, like on day 1, giving you a 1 serving 2 ingredient banana pancake, 3/4 of a cup of raspberries, 1/4 of a cup of plain low-fat Greek yogurt, 2 tablespoons of sliced almonds. For a snack, you would have a medium apple with 1 tablespoon of peanut butter. If you have never had an apple with peanut butter on it, you don't know what you're missing. To me, it kind of reminds me of a caramel apple. It's a nice snack. Lunch, they tell you to have that vegetable weight loss soup and a whole wheat baguette. Snack might be that 1 serving of your homemade trail mix. Dinner might be grilled cod, lemon garlic grilled cod, 1/2 cup of cooked brown rice, 1 cup of steamed green beans. And then they give you a serving snack at the end of the day for 1 serving of pretzels with dark chocolate and peanut butter. I don't know what that would be like. The daily total for that would be 1,495 calories. To make it 1,200 calories, you would change that apple to half an apple with no peanut butter, and you would do away with that PM snack. If you needed more calories, they tell you to add hard-boiled eggs, increase to 2 tablespoons peanut butter, and 2 slices of that baguette at lunch, and 1 full cup of brown rice. There's a lot of ideas here, but the main thing is there is also recipes that are highlighted in this that you can download and get an idea of something that you would like to do for those meal plans. So there are some pretty good suggestions with this. And all in all, it looks like it's decent, nice little meal plan. Like I said, that meal plan is at eatingwell.com. And you would put in that search bar, search for 7-day no sugar meal plan for insulin resistance. I won't link it down below because YouTube will flag it because it doesn't come from a government site. which, whatever. So, and I'm sure that this diet is probably an exact replica of one from the American Diet, Diabetes Association, or even National Institute of Diabetic Health, their disease for, that kind of thing. But I'm sure that those are all there in those places. So I would suggest checking it out because from the looks of it, it does look like it's a very varied diet or recipe plan. And the other thing is you get some great recipes out of it. So you can't go wrong there either way. All right, guys, that is it for the Healthier You today. I hope you did enjoy it. My health is getting better a little bit. Today I'm just a little sore. Voice is still a little hoarse, but we'll work through that. All right, guys, remember, I will see you again soon. Remember to be a little kinder to yourself. Get out there and see this big, beautiful world we live in. Get moving a little bit today. I'll see you again tomorrow. Bye.